Hi Beauty Boosters, my name is Anissa Munchie. I am the nurse practitioner and owner of BeautyBoost Med Spa. Thank you so much for tuning in. I'm super excited to be filming another YouTube video for you guys. My last one was about my journey as becoming a nurse practitioner and injector. So this one is especially exciting because it takes us on our journey of BeautyBoost growth. Right now it's only 1 year old and I get a lot of questions from you guys on Instagram where I do showcase my work here at BeautyBoost in terms of questions you have about procedures, about the profession, or just about life in general. Yesterday I did post a little story on our Instagram about questions you guys might have, so I'm happy to answer it here on this video for you guys. But as always, feel free to ask questions in our direct messages because I always get around to answering all of them. If you haven't done so already, go ahead and subscribe to the channel and follow me on Instagram. Without further ado, let's get started. Okay guys, so the first question we got was, what do you recommend is best? Chin implant, chin or jawline filler, and or Botox? So this is a great question. I get this all the time. Should I just go straight for the implant? Should I try out filler in my chin? Should I complement it with jawline filler? And here's what I tell patients. I always tell them, try out the filler first. I think that's a great preview. For example, if you turn to the side and you notice that your profile could be better in terms of a little more projection in the chin, a little sharper in the jawline. By the way, I have like 3 syringes, so this is not so much natural and you guys can achieve this too. But if you want a little more here and a little more here, try out filler first. It lasts anywhere between 1 to 2 years. If you're in love with the look and you don't want to keep getting re-injected year after year, get the implant. You can't get implant for a jawline, so just keep in mind that's only available for the implant for the chin. In terms of Botox, you can do Botox in your chin. I love Botox in the chin to help with it's called chinulite, where you get a little dimpling and people talk like this. I think it's great to relax that dimpling. Botox in the jawline helps slim the masseters. If you want to see a before and after, check out our Instagram page because I have tons of Botox masseter reduction before and after there. Okay guys, so the next question I have is, what are great day and night face lotions for skincare? So here at BeautyBoost Med Spa, I only believe in one line only, and it's Xenobaji, also known as Zeo Skin Health. It's a phenomenal line, and I'll tell you why. It's prescription strength and medical grade. That means that the concentration in these products have to be monitored by a medical provider. You don't want to overdo it. I do follow up on all my patients on these type of skincare products month after month to make sure you're getting results. You cannot find this in any drugstore. You can't find this in a department store. Believe me, I was that girl. I would spend crazy money on La Mer, all the high-end products that, Kim Kardashian swears by. It doesn't do the clinical results that you want it to. Come on in. I'm happy to throw you girls on a customized skincare regimen made for your skin. There's one for acne, there's one for rosacea, there's one for mature skin, there's one for even younger skin that will help prevent the anti-aging process. So come on in and I'll get you girls on one of those. Okay, so the next question we have, is it best to stay with the same filler in one area, or can you add on a different filler a few months later? This is a great question. I get this question all the time as well. So most fillers are composed of hyaluronic acid. Whether you get Juvederm or Restylane or, one of the Juvederm family of fillers like Velour, Voluma, Volbella, or the other Restylane family of fillers, which is Refine, Define. It's okay to make hybrids of these guys. They all, at the end of the day, are composed of the same base material, and that's hyaluronic acid. Now, there are other fillers such as Radius, which is calcium-based filler. I don't recommend doing a hybrid combination with those type of fillers. Those act and perform differently, so I would suggest putting that in different areas of your face. But in terms of other hyaluronic-based fillers, it's completely fine to layer and mix it up. So the next question I got is, I'm a huge fan of your work. In the future, I'd love to work in cosmetic dermatology, and I have some questions about further training. What did you do as a nurse practitioner to specialize in aesthetics? Did you train for aesthetics while you're in nursing school? And lastly, what are your tips on opening up a medical spa? Again, tons of questions on this. I'm so happy I'm inspiring and other girls are coming into this field because I truly think it is so much fun to do what I do. Of course, there are some areas you have to be careful, and not everyone's going to be happy with your work, and that's totally fine. But in regards to this question, what I did to help me prep for this industry is, during nursing school and my nurse practitioner school, I used to read everything and anything available to get more familiar with the lingo and anatomy. Anatomy is so important, and you'll hear this on and on and on about injecting. The reason why is that we want to prevent adverse events from happening. So to answer your question, during schooling, I did do a lot of reading. I consulted with a lot of different practitioners, plastic surgeons. They helped guide me during the whole process. And then remember, this is all about dexterity. So the more you can practice, the better you will get at technique. I always compare this to makeup. Do you remember when you did your winged eyeliner and how shaky you were and how weird it got? Same thing, you will get better at it. Remember, practice makes perfect, and make sure you you have a really good foundation for anatomy. The next question she said was, what are some tips on opening up your own medical spa as a nurse practitioner? It's a lot of work, guys. I know it looks fun and easy, but I work 10-hour days, 6 days a week. It probably comes out to about 60 hours a week. It's worth it if you have the drive, the passion, and you just have always seen yourself owning a business. I highly, highly recommend it. I say partner up. You know, in the state of California, it does require you to have a medical director who is a physician to be 51% owner. Find someone that is a physician that you really can trust, that can have your back in terms of making sure that your patients are taken care of and you are performing safe practices. And then once you have that foundation down, it's all about finding a lease, having your malpractice in place, knowing what procedures you want to offer, knowing the demographic you want to target. All that will come. But I think the biggest thing is to make sure you have a good partner in business with, and then from there you will find your own route. I'd love to spell it out for you guys, but everyone has their own journey in creating their own business. Okay, the next question I have is, what is the most stressful part of your job? I think before I had a medical assistant, I was a one-woman show, you guys. I would greet the patient when they walked in, I would room them in the room, and then I would go over the consultation with them. I'd go get the treatment plan and the quote, present it to them, then I'd set up the tray, do the procedure, clean up, take my pictures, put the before and after, and then I'd have my front desk check them out and do a follow-up visit. That was so hard doing everything on my own. I did not have to do this, but I think it made me stronger in terms of being a better clinician because I really saw the beginning to end of every process. I had Giovanna, who's my incredible medical assistant. She had no medical background beforehand, but I trained her, and I think because she's doing so well, she's going to advance in the field. But you are a one-person show. You have to answer texts at all hours of the day in terms of complications happening, people not being satisfied with the result or just enhancing it a little bit further. You are giving a lot, and at the end of the day, it does get exhausting. So make sure you take care of yourself, because as medical providers, we are constantly giving, and it's really important to take time for yourself. So go on your vacations, have your girls' nights, do whatever you got to do to make sure that you're happy too, because ultimately your patients will be happy as well. The next question I had, this is hilarious, you guys. This is really funny, and I laughed out loud when I read it, but it's such a question that I'm sure everyone has. And this girl asked that she was noticing during spin class is starting to get a little uncomfortable downstairs. So her and her girlfriends were joking that they needed a Baja lip filler. So instead of these lip fillers, those lip fillers. So she was wondering if that's actually a thing. I actually had to do some research myself because I'm like, oh, I wonder if it is a thing. And I guess you can get fillers in your labia majora. And I think what they were saying on these articles that I was reading was that a more plumper outer lip area translates to a more youthful appearance of downstairs. And I think as we age, our labia minora starts to extend and show a little bit more, whereas the majora kind of stays put. So in plumping up the outer lips, oh, sorry for that, the outer lips, I guess when I say that it provides more coverage, that's my understanding of why you'd want to plump up that area. So they are being done. I cannot perform them. I'm strictly face and neck here. If you do find a gynecologist that is comfortable performing dermal fillers in that area, go for it. I think they are the most qualified person for this area. Things you should know about the risk involved with this is scarring, disfigurement, and infection. Remember, this is a dirty area. In terms of it padding yourself for spin class, I don't know. They didn't do a lot of discussion on that throughout these articles I was reading, so I can't speak on behalf of that. But I hope that answers your questions. All right, guys, that's it. This was so much fun answering all of your questions. Please ask away. I'm happy to answer any and every question. Follow us on Instagram, slide in my DM, and I'll do another one of these videos for you guys soon. Thank you so much, guys. Bye-bye.